Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hi there, and welcome to another Skin Sync podcast. My name is Shannon Moranti.
And I'm Buccinita.
And we wanted to welcome you all today to a little fun game of Would You Rather. I thought that it would be very fun for Bucci and I to get to know each other by just throwing out some questions that sometimes arise in our offices. Bucci, I am sure that there are times in clinic when different scenarios arise, and we are certainly not the only dermatology PAs or nurse practitioners out there that have these frustrations. So I thought it would be fun to bounce some questions off of each other and figure each other out a little bit, maybe learn a bit about each other, and maybe have our audience learn about our preferences as well. So I'm going to get things started. Would you rather have a screaming child in one room or a super grouchy old man in the next room? Like, which room would you rather go into?
We'll take grouchy old man 100% of the time. I think for me, because maybe I have children that are slightly older, they're ages 6 and 9. We're past the infancy stage. I'm not having any more children. I think the sound of a crying child it's intense. Sometimes it's challenging for me. A grouchy old man, I can almost always win him over. It doesn't take much. Just chat with him a little bit, ask about those grandkids, ask about his wife, which cruise is he going on next. I think it's really easy to win them over. So I will take grouchy old man 1,000% of the time. How about you?
Okay, I love that answer because I would probably choose the kiddo. As you know, I have 4
Really?
kids.
That's
I
true.
love kids. I love being goofy around kiddos. So I'll get down on the floor. I'll blow up a glove balloon. I'll start to make funny faces if they're little. We do have a treasure box in our office, which is a really fun thing that you can buy for $20 on Amazon. And it is amazing what kids will agree to for a, silly dinky toy from Amazon. So I think sometimes we do have to be like the dancing show bear a little bit for our kiddos and for our pediatric patients. But I'm going to choose the screaming child because I think I can win them over.
I think that's actually a great idea. So I've never thought about the treasure box. I used to go to the dollar store and buy little gifts for the kids, but you said Amazon has a kit you can just purchase?
Oh yeah, and it actually looks like a treasure box. It looks like a
Okay.
pirate treasure box. It comes with all kinds of tchotchkes and all kinds of little plastic pieces of junk, but there's stickers, and I mean you can obviously choose whatever you want, but I don't want to hype them up on sugar and send them out the door, so I'd much rather give them little junky toys that'll get lost in mom's car on the way home.
Perfect. I love that. My son has treasure box every Friday at school and he raves about it. So I think we're going to do this. Thank you for letting me know about that.
Absolutely,
All right.
absolutely.
So I've got one for you. So would you rather see a teenage patient with horrible acne who desperately needs Accutane, but the mom is absolutely refusing because she's heard horrible things about it? Or would you rather have a younger patient with atopic dermatitis who needs systemic therapy, but mom wants only natural and clean ingredients on her baby? What would you do?
Those are some great questions. And actually, I think I saw both of those today in my clinic. So totally relevant. I'm going with the acne. Even though that's a tough discussion, I feel like I am so passionate about treating acne and so passionate about treating with Accutane. And I know in my heart of hearts that that's going to be best for that kiddo. And I'm going to try to do my hardest and do my darndest, if that is a word, to convince that mama that this is definitely in the child's best interest to prevent scarring. I think we all need to have a script. We all need to have something that we can kind of pull out of the back of our memory whenever parents are putting up a really strong wall. And I really try to lead with questions. I like to say, oh, okay, well, why? Why do you feel this way? It doesn't seem intrusive when I ask them that, but sometimes they've heard misinformation, or
Absolutely.
sometimes maybe they've seen something on socials, or a friend's neighbor's ex-dog walker told them that Accutane was going to make their kid infertile or something. So I love actually kind of diving into the misinformation and giving them actually the correct, educated information on why this is such an important medication for their child. But how about you? What would you rather?
So I completely agree with you. I really actually love convincing a resistant parent to allow us to put their child on Accutane, because most of the time it's not the patient themselves. These teenagers often they hate their acne, they're miserable with it, and they're the ones living with it. But oftentimes, if you really dig a little bit deeper with these parents, you can get to the bottom of it, just like you said, and really kind of convince them, correct that misinformation and really give them accurate info that will help their patient get their child get clear. And it's a game changer. It's a life changer for them. So I'm
For
with you.
sure, for sure. I mean, not that the kiddo with terrible AD does not need systemic
Of
therapy,
course.
but I kind of think that's an easier ask, you know? Okay, next one. Would you rather see a patient that comes in for a full body skin exam and you can see from the door that you're going to be doing at least 10 biopsies and at least 47,000 liquid nitrogen treatments and also probably prescribing X, Y, and Z? You know, this is going to be a very complex, very complicated visit, but they're at least in a gown and they're ready to roll. Or the person that just says, I have a list with spots of concern, and then their list is 47 things long. Would you rather find them, or do you like to actually be told what their exact spots of concerns are?
Now, I'll say this. I do like a list because that's just how my brain functions on list. So I don't mind the list so much. However, I will take the skin cancer patient almost every time. I like things where there's just clarity, right? We're going to do your full skin exam. I'm going to get my pen out and start marking locations, and we're going to get our biopsies done and move about for our day. And so I think that's a much easier situation. Oftentimes that patient with the list may have, well, what can I do for my skin? What kind of skincare routine should I be using? That's a
Right.
loaded question, right? So, that may take me an extra 5-minute conversation when they wanted to ask about the blood vessels and the rosacea, the acne and the hair loss. And it's so many things, and it's overwhelming both for me and for the patient. And I feel like most of the time I'm going to forget something, they'll forget something. I find that those are less satisfying for both myself and the patient. So I like to kind of buckle down, focus on that full body, get those cancers off, and keep it moving. How about you?
Very, very true. I often joke that I have Medicare mornings and acne and AG afternoons in Naples, Florida, because I feel like all of the golfers and all of my, sweet little snowbirds and all of my Medicare patients want to get want to get their visit done early. So they come in super, super early. They want to get all of their biopsies done and then get on with their day and go off to lunch. Where I do love that full body skin exam patient that's just like, okay, let's get this over with and lets me work through my process and is not skipping around like on their checklist of, wait, I had one on my forehead and one on my toe and one on my elbow and then one on this elbow and then one on the chest and then one on the back. I love to do my full body skin exams from tip to toes, and I like to work through my process. But I could see how some people would love a list, because then you address all of their concerns, you make sure that every single box is checked, and then you can go about doing your process later.
And at least with the list, one thing I will say is that if I cannot address everything, I'll tell them that, like, listen, this is going to be a detailed conversation. I really love to get into detail about hair loss. Let's bring you back for another visit to have this conversation. So I think there's a way to kind of strategize that list to make it still efficient and you're not stuck in that room for half an hour. So, all right. So, next question that I have for you: would you rather see a patient who works in the medical field? So, we're talking our nurses, we're talking physicians, perhaps other APPs like ourselves, or would you prefer to have the sweet, old, kind pharma from the middle of nowhere, Georgia, who just wants you to make every medical decision for them?
That is a great question. But I feel like this really depends upon your personality, right? Because I feel like some people love to talk medical, and I do love getting into great conversations with the medical folk, if you will. And I just saw an 83-year-old ER physician in my practice today, and he could not have been kinder and more appreciative of great care. And we talked through a lot of different things, and I love having those conversations. So I'm probably going to choose the medical provider. But you know what? I think in the beginning of my practice early on, I probably would have chosen that farmer every day of the week. How about you?
Yeah, I agree with you. So, especially nowadays with so many therapies and so many new medications, I really love, especially like a new psoriasis patient, right? I love getting into that conversation about what your options are, and into the science behind it and giving them the whys and the risk and benefits. I really enjoy those conversations. While I do appreciate a patient allowing me to have the liberty to make those choices, I really prefer more of a shared kind of decision making. So for me, I'm going to choose that medical provider. And hopefully, we don't get too much pushback or resistance, but most of the time, I feel like they're just open to conversation and they want to get to the details with you.
I totally agree with you on that one. But I can see again how those new providers may have a different point of view. But I encourage you, all of you out there that are new providers, truly learn from those experiences and don't be intimidated. Take the time to to be proud of yourself and know your stuff and make them know that you are confident enough to have those deep conversations on therapeutic options with them. Okay, this is a good one. Would you rather see 5 patients in a row with horrible plantar warts or 5 patients in a row with devastating, like, thinning hair? I won't say hair loss because not alopecia areata, but thinning hair.
5 in a row, Shanna?
5 in a row, like back to back, you
I'm
know?
gonna take the warts. I will take double the amount of warts as a matter of fact. So, and I'll tell you why. So, obviously back for many, many years, warts have been really difficult to treat. For a long time, I would do cryotherapy on plantar warts, and that was kind of the primary treatment. And it was very rarely effective. They would always have to come back. It was very painful for them. So, but the brilliant Dr. Lisa Swanson over the years has shared her favorite method for treating warts, which is a compounded topical fluorouracil with salicylic acid. It works beautifully. It's a topical cream, and I've used it personally. I've used it on my kid. I've used it on many patients. It works extremely well. It is out of pocket. It is a little bit on the pricey side, but it's so worth it. So I will take every single plantar wart. Hair loss, while I do love it and I do feel like I'm getting much better in my practice at treating it, it is almost never a short visit. I mean, we're talking 15 to 20 minutes every time. There's some workup involved with that. There's counseling. There's that hand holding. It just takes a lot more time than what I'm sometimes able to give in a single visit. So I think that warts are it for sure. Yeah.
I I really actually agree with you on this one. So, both of my parents are podiatrists. I have a lot of foot people in my family, and I would be very grateful to see terrible plantar warts to walk in
Yeah.
any day of the week because I mean, my heart just goes out to these, especially women that are so devastated with their thinning hair. But I'm going to be very grateful for every wart that walks into clinic tomorrow when I consider the fact that I could have had 5 hair losses in a row. All right, your turn. What's next?
So this one might be maybe, I don't know. We'll see if it's easy for you or not. So would you rather have a patient who comes in with hundreds of sepques all over their body that they insist on having removed in whatever fashion you choose? Or would you rather have a patient that comes in with the very acutely painful pilonidal abscess like I had today
Oh.
that needs to be drained and lanced immediately? What would you choose?
Give me those SKs every day of the week. I mean, pilonidal cysts, like, just hurt my heart, and I just feel so terrible for anybody who has to walk around with that, sit down with that, lay down. Is there a comfortable position with a
No,
pilonidal cyst? I don't
no.
think so. And I know that my poor patients with SKs are going to have felt like they were just attacked by 1,000 bees, but they will get over it, and they will be grateful that those SKs are gone. Speaking of compounds, there's a couple really cool compounds for SKs. There's actually some SK pens out there that you can prescribe. So I'll typically freeze their like most bothersome 15 to, 14 to 15 SKs or so. And then I usually prescribe the SK pens that are a compounded version that they can actually apply at home and say, good luck, come back and see me if you need some more done in the future. And we got to try to keep that really short.
Do you think the SK pens work pretty well?
I mean, you really have to be very, very diligent about
Okay.
using it every single day for probably 2 to 3 weeks. But they'll get enough of an irritation and almost like enough of a chemical burn that a lot of the SK will come off. And so I've seen some really nice result with that. Sometimes we have to clean up some of the large ones with cryo. So I just tell them like only do a few at a time, do 3 to 5 at a time, and just kind of attack those and then see how it goes. But patients are usually pretty receptive to it and they love doing stuff at home. And I'd much rather give them a therapy that I suggest instead of something that they've like a blowtorch that they decided to bring out of their garage or
Yeah.
something.
Yeah, we've seen those disasters come through the office, but that's really helpful. I think I underutilized the SK pen, so I'm gonna look
Oh,
into
yeah.
that. Now, for me, I actually think it depends on the day. While I don't mind freezing AKs, it's kind of boring, and I don't always wanna sit there for, 10 minutes just blasting AKs, and half the time the patients are jumping off the table and wiggling around. You gotta chase
Oh,
them
for
down with your
sure.
cryotherapy. Sometimes I like assist. It depends on how my schedule's going and if I'm running behind on clinic, but I enjoy it. I feel like maybe because I don't do a lot of surgical procedures in the clinic, it's kind kind of my version of surgery. I get gloved up, I get my goggles on, I get my mask on, I get the music blasting, and we just get in there and lance that thing. And I think because patients get such great relief from it, I think it's really, really fun. So I enjoy cyst. The smell, you kind of get used to that after a while, even after 15 years. It's just a cyst. That's how it smells. But I think it's quick relief. It's fun to do. I really enjoy it. So I think some days I'm going to choose the cyst.
I love that we have such different opinions. This is so great because I feel like I need to maybe embrace a cyst a
Embrace
little
the
bit
cyst.
more, like embrace the abscess.
Yeah.
I don't know. I don't love them. I really don't. I must be honest. Okay, this is kind of a gross one, but would you rather have someone with terrible genital warts that you're going to have to freeze and actually actively do something for them? Or have that really hard HSV, like genital herpes conversation that, we don't know if we just contracted this last night or 15 years ago.
I will take warts for sure. So I feel like with genital warts, the counseling is still there, right? Even if it's a male patient. So you're still
For
going to
sure.
tell them what they have. You're still going to counsel them on, what it means. If they're sexually active with female partners, you want to maybe counsel them to have those partners get their HPV testing and the pap smears. But I think it's a pretty straightforward conversation for the most part. With genital herpes, I feel like they're number one, oftentimes they've been misdiagnosed, right? They've been told by urgent care or
Uh,
primary care that they have recurring shingles, which is just not a thing. It doesn't happen. Yes, you can have shingles more than once, but it doesn't tend to recur in the same location every
exactly.
time for years on end, right? So I think that's getting the diagnosis correct is important. And then number two, when you do get the diagnosis, trying to explain to them what it is. And of course, they immediately accuse, and this is usually the females accusing their husbands of cheating,
Exactly.
right? And it's like, you don't know what to say. You don't know what to do. You don't know how to approach that. I'm like, well, ma'am, you could have been exposed to this, decades ago. There's no telling when you were exposed and when you just decided to show symptoms. So I think that is a much harder conversation for me. They leave oftentimes confused. I'm confused because I don't really know how to approach that. So even though the treatment is relatively easy, you give them some oral, valcyclovir, that conversation is much more difficult. So warts for sure. I like warts apparently. How about
I
you?
would have to agree, and apparently warts are winning tonight because I would have to say I agree with that as well, and even though they're very difficult conversations to have and are very, really important conversations to have, especially with males, may not have any idea that they could spread HPV to a female partner that could potentially lead to cervical dysplasia and cervical cancer, so we need to make sure we are reiterating that and that we have that information and sometimes have that information in multiple languages to be able to give to patients as a handout and make sure that we're counseling that. But who knew? Who knew we loved words so much, Bushi?
I think I really underappreciate warts in my clinics. I will go into work tomorrow with a new appreciation for warts. So any other questions, any other would you rathers that you wanted to share?
I think that was an awesome
Yeah,
start. I think we should do this every once in a
I
while and
think we
just kind
should.
of get to know each other a little bit better. And maybe if you listening out there have any other ideas or any other kind of fun getting to know you back and forths, we are all ears. We want to hear your ideas. We want to hear what you're thinking. Ultimately, we want this to be informative, but we want this to be fun. So, Pucci, this was so much fun getting to know you tonight
It's a
and
lot
getting
of fun. I appreciate this.
absolutely diving into kind of what we do. And even though we have the exact same job and similar titles, we're in totally different areas. So it's nice to know that we do have so many commonalities. So thank you for spending some time with me tonight. I appreciate you.
Stay tuned for the next episode of Skin Sync. Until next time.
Bye bye.
Bye, guys.
Thanks for tuning in to Skin Sync. Don't forget to subscribe to Skin Sync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.